Good morning, commissioners. My name is Brandon Wilson, Project Analyst, Administrative Services. This was a fun project to be a part of, getting to vote, seeing all these awesome submissions that came in. It was hard to just pick three. I have the honor to introduce the last winner that we chose, which is VRDOT, which is also known as the Video Recorded Directly Observed Therapy. So this was very cool. I personally really enjoyed getting to learn about it. So if I could have Susan Whelan and her team come on up. Susan will introduce the nominees and give an overview of the project.
All right.
Good morning again, commissioners. I'm very excited to have our recognition among some of the great projects that have already been recognized. And this is in dealing with diseases. And we have, part of our team is here and part of our team are not able to be here. So we have Demi Omklove, Vanessa Miller, which is, she's a nurse, she's not able to be here. Shannon Rowe, a communicable disease epidemiologist. Carrie Swinehart, a disease prevention nurse. Robin Trujillo, a disease prevention nurse. Robin Weber, who is not able to be here with us. And Haley Zachary, who is not able to be with us today. So El Paso County Public Health is responsible for monitoring over 60 different diseases 24/7 in the community. So when we talk about public safety, law enforcement, they do investigations for crime. We are 24/7 around the clock doing disease investigations. And a lot of times, as Dan Martindale had said, the public doesn't hear about many of these disease investigations because we're doing a good job and there's no reason to alert the public in many of these situations. This video recorded direct observed therapy is a project that this team took on to be more efficient and to provide better services for the clients that are required to do direct observed therapy. Persons with tuberculosis disease must be treated with correct medications. And sometimes these medications involve 20 pills per day. And sometimes it involves every single day for 3 months. And sometimes it involves up to 6 months. And so you can see sometimes what a challenge it is maybe to take 1 vitamin per day, much less 20 pills per day. So our team is required to observe that the medications are being taken appropriately and also on time. And the whole goal of this medication oversight is to ensure that there is no disease spread in the community. So it is a public safety situation. The way that this happens is through this project, the staff have come up with an idea to use a secure way for clients to record themselves following a set of criteria so our staff can see the recording of them taking their medication and confirm that their medication is taken appropriately. And as vast as El Paso County is in square foot miles, you can imagine how much time and money that this does save. We can do easily over 600 direct observed therapies in a year. And the cost to the health department prior to this video recorded direct observed therapy was nearly $40, and now it's $1.10. So that's quite a savings. Some of the outcomes of this program is it gives improved adherence to the TB medication requirements by reducing barriers to treatment. Sometimes it's hard for clients to come into the health department, and scheduling also, around their work schedule. It gives them more control over when they are able to take their medication. As I mentioned before, it's a huge cost savings and a time saver. We're estimating 3,000% increase in improved staff efficiency by reducing home visits. And this also prevents the spread of TB by supporting TB patients with the completion of regimen of required medications. And we've already seen and heard from the clients that they really appreciate this service and the ability to have more control over when they're taking their medication. So we're seeing some good results. And the main thing is that they're completing their medications on time and as planned. So this is something that the staff has worked really hard on, and it started late in 2016, and they've done a great job. And I'd ask any of them to come up and maybe say a few words about what they do.
So, I'm Shannon. I'm the interim program manager for communicable disease and tuberculosis. And I have to say that I feel like it's truly rewarding to be able to save money and provide our clients with some independence for their treatment. And I'd like Robin, if she wouldn't mind, to say a few words since she was integral in getting this started.
Hi, I'm Robin Trujillo, public health nurse with El Paso County Public Health. And I just wanted to throw a couple of numbers out there just so you guys can see, you've seen the monetary picture, but as Susan was saying, El Paso County is vast, and at one point we had several clients on directly observed therapy, and we were doing a 94-mile round trip a day with 2 nurses in the office. So if you can imagine, that would take one of us out of the office for at least a half of a day. And when you're talking about tuberculosis case management, there's a lot of other things besides just watching these patients take their medication that goes into that case management piece. As well as, I wanted to say, for tuberculosis treatment, the directly observed therapy is the gold standard of treatment for tuberculosis therapy. Studies do show that 86 to 90% of patients who are taking their medication under directly observed therapy will finish their therapy, as opposed to, I believe, a 61% for those who are not on DOT. And so when we're talking about completion of therapy, we're thinking about things like drug resistance. And if you're looking at TB as a global, from a global perspective, there are, one of the things we want patients to finish their treatment for is so that we don't have multi-drug resistant TB. And if you're looking globally, there's a lot of countries that do have multi-drug resistant TB, and in some cases, extremely drug resistant TB, which multi-drug resistant TB is really hard to treat, and the treatment is up to 2 years. So when you're talking 6 months as minimum treatment, 2 years is a long time for somebody to take medications. And in the extremely drug-resistant TB, those are nearly impossible to treat. So having patients complete their therapy and being able to do so more efficiently is really important to the public health. Thank you.
Wow, impressive. That's not bad.